Well, hello there, watching the press preview, a first look at what is on the front pages. Time then to see what's making the headlines with the Daily Mirror's associate editor, Kevin Maguire, and the Spectator's economics editor, Kate Andrews. Welcome and great to see both of you. So to the front pages then, let's see what's making the news. The Eye to start with, leading with Sir Keir Starmer promising what the paper calls the biggest shake-up of the NHS since 1948. Labour orders the biggest NHS reform in history. That is the headline on the front page of The Times. It's also on the front of The Telegraph, which focuses on claims the NHS is doing less work for patients despite record funding. Well, the front of the Daily Mail is leading on the same story. Its headline, "The NHS must reform or die," says the Prime Minister. The Guardian focuses on the inquiry, which has found that thousands of people are dying due to delays in the health service. Same story for the Mirror, which highlights years of Tory neglect and botched reforms. And the Express on this story with its headline, "No more sticking plasters." The Metro has the story, meanwhile, of Oliver Campbell, whose conviction for murder has been quashed after 33 years, with judges ruling that a confession was bullied out of him. The Financial Times sums up the US presidential contest like this. Trump camp fights to regain footing after Harris delivers blows in the TV debate. And in response to outlandish statements from Trump and Elon Musk, the star mockingly cries out for a psychiatric nurse. Well, don't forget, by scanning the QR code that you'll see on screen during the programme, you can check out the front pages of tomorrow's newspapers while you listen to our guests. So let's head to Kevin and Kate. Welcome to both of you. With the breaking news, actually, of this NHS study, which has been carried out in 9 weeks by Lord Darzi. It comes before Sir Keir Starmer speaks about the need to reform or die. Kate, what's your take on what we've heard?
It's a 142-page report, as you say, produced in a very limited window of time, but the Health Secretary, Wes Streeting, made very clear to Lord Darzi that this was urgent, this was necessary. When he entered Downing Street to accept the job formally of Health Secretary, he was not praising the NHS. He was saying, we are done with all that. We are going to start tackling it. This is the first step. It is a damning report. I mean, there have been plenty of reports, countless, frankly, over the years showing that the NHS lags behind its counterparts, especially in Europe. But I mean, some of these stats are overwhelming. In 2009, if you went to A&E, there were roughly 40 people ahead of you. In 2024, there are 100 people ahead of you. In over a decade, the NHS has not made progress in getting better at spotting cancer in stage 1 rather than in stage 2. I mean, these are lives on the line that we're talking about. I think as we discuss this story, the big question is going to be, well, what exactly do you do? Because Keir Starmer is going to talk about reform or die, about the biggest change in the NHS since its birth. He's also going to say that he's fundamentally not changing the service. It is going to be taxpayer funded, free at the point of use. That guarantees rationing with wait times. And if you're rationing with wait times, many of the things he wants to do, like pivot towards preventative care, are going to be very hard to do.
Yeah, lots of detail in this, but 3 fundamentals, first of all, from Lord Darzi. 1, that people are living longer and in ill health. Yeah. 2, there's low productivity in hospitals and that staff morale is extremely bad. 3 fundamentals we're going to learn from Sir Keir Starmer. 1, the need to move from an analogue service to a digital service, a tomorrow service, he's going to call it. Shift more care from hospitals to communities, something perhaps the Conservatives also tried to do, and be bolder in moving from sickness to prevention, which might start to explain the cigarette smoking in pub gardens, for example. So your takeaways from all of this, Kevin, because there's a lot more detail in it.
Those 3 missions are all admirable and probably where you should go. But how do you do it when you've got to treat people under the existing system now? This report, I think a Conservative government would have balked at commissioning it, never mind publishing it. Labour have gone for broke on this. There will be a lot of questions around, you've done this in 9 weeks, is it proper thorough job? There'll be a lot of picking it apart, as there should be, in terms of...
Yeah, I mean, he's a widely respected surgeon. He's a former health minister.
He is. He's a Labour former minister.
It's not like he doesn't know his subject matter.
Yes, but how you get there, you'll find, I think, other groups within the NHS will begin questioning, maybe some patient groups too. And so we shouldn't say it's absolutely set in stone and it is the gold standard report.
But
nevertheless, it's absolutely damning and is going to be the centre of debate now. But how you shake it up now, I don't believe in changing the funding model. If you say, right, there is now rationing by waiting list, unquestionably. Do you want rationing by income? You can buy your way in, or if you haven't got the money, then you don't get the same treatment.
Are we already seeing a shift? More people are going for private GP services,
no, but it's on the edges at the moment. And do you want to keep on going down that line? I would argue not. Kate might say yes, but if it's going back in terms of waiting lists have gone up, cancer outcomes are worse, heart figures are getting worse. You can't get a GP. Something has to be done, unquestionably, and it is a huge job.
But the fundamentals around the NHS as well, for example, social care, getting people out of hospital swiftly, mental health services are also inadequate. And actually, the report has found that at the start of this year, 2.8 million people were economically inactive. Most of the rise since the pandemic was down to mental health conditions. Now, we know if you've got a serious illness, you also often have a mental health condition. So the two are not unrelated sometimes. But the point is, if you don't sort the ancillary services, how can you actually reform the health service?
It's got to be a huge, holistic. It's a massive job to turn it around. I think if it needs turning around, it has to be turned around. There's it's the nearest we have to a national religion, but there is no point saying it is beyond criticism and everything is fine, when it clearly isn't. Anybody who goes to a hospital will see crumbling buildings. You will see shortages of beds.
Well, Victoria Atkins, former Tory Health Secretary, will say that they had a massive building programme under even Boris Johnson, if you remember. Darcy...
It's a massive building programme that didn't build. I mean, that was it. It's all right announcing a building programme, but you've actually got a bit of bricks and mortar would be nice.
Yeah, Lord Darcy, and the quotes here in the Daily Mail as well, says it's in a critical condition, the NHS, but vital signs are strong. Now, would you agree that actually the vital signs are strong, given the numbers of people waiting for often very serious treatments in the NHS?
I think it shows how low the bar is now. I think it just shows, what the public realistically believe they can get is a low bar. They think it is going to involve waiting months on end, sometimes for very serious surgery. And you pointed out there that more and more people are using what disposable income they may have, and in some cases it may not be much at all, to try to help themselves or their families get seen by a doctor sooner. And that's why I don't think this is so black and white. You never want a system that doesn't have a safety net for its poorest and people who couldn't afford health care. But apart from the United States, almost every developed country in the world has a mixed kind of system.
But you can't get away. If you go back to 2010, you had near record satisfaction and low waiting lists. And it went wrong, as the report details. It went wrong after 2010 when the tightest financial straitjacket was imposed on the NHS in its history.
Hold on. So it blames austerity, but it also blames reforms in 2012, actually, under Andrew Lansley. Now, that's so long ago, none of us can really remember them, but they were...
I remember them.
OK, so go on. In one sentence.
It was to set up an internal market system, which Labour always said was going to lead to privatisation. It led to very little privatisation, but it was incredibly bureaucratic and it was incredibly expensive. And it was so unfathomable that Lansley was essentially moved aside at one point and Oliver Letwin was brought in to try and make it work. It was a complete mess. They said there was going to be no more top-down reorganisation, and they came and immediately put one in. At the same time, squeezing the financial life out of the NHS.
But hold on, you're never going to have a single-payer nationalised system that isn't top-down. That's fundamentally not realistic, and you're going to struggle to point to any system that does. I think the Guardian front page here is really the key issue here, that people are dying. People are dying because the system hasn't been working. And you made an interesting point earlier about Labour being willing to do this report. I completely agree that the Tories wouldn't have gone near this. I mean, they were praying to the NHS, literally in Westminster Abbey last summer, because they were too afraid to talk about the realities. It is very positive to see Labour talking about the realities. This isn't just a UK issue. Western countries around the world are trying to figure out how they're going to pay for their healthcare, but it's also not a party political issue. It's easy to say, oh, well, the Tories have been in power. Of course they need to take a lot of responsibility here, but the NHS funding in real terms has been going up practically every year, apart from some COVID money. Hold on. Apart from some COVID money, it's been going up every year in real terms. It's worth about 45% of day-to-day public spending now. We really are getting close to having a health service with a nation attached. Demographics are only moving one way. If you don't start addressing the fundamental roots of this, it's not going to be here. That might be true of other systems too.
But
you can't be so wedded.
Roots that actually it's a victim of its own success, as in it's keeping us all alive.
Yeah, but let's.
So to be honest, I'm not as convinced. I'm not as convinced by that argument in this. And this is really tricky stuff to talk about, right?
Okay.
But the longer we live, the more expensive we are to the healthcare service. We need to figure out a way.
Which is the other
we need to figure out a way to live longer and to have an affordable healthcare system.
If you, just quickly, I mean, there's
no, but we're
the
looking at the
inside
Guardian.
pages
You say
of
take the party politics out of it. As it said, Darcy's scathing indictment of Conservatives' 14-year stewardship. This is in the report, right? So you take out the party politics if you like, but it is in the report. Talks about A&E going backwards. Now, it's got to be fixed because he's come up with a figure. There are 14,000 more deaths a year because people are waiting. That is appalling. That figure, Darcy said, is more than double all armed forces combat deaths since 1948 when the NHS was created.
You'll struggle to find anybody more critical of the Tory party than me when it comes to their treatment of the NHS. But the point I'm making here is even if you go back before that, this idea that it was ever really the envy of the world in modern times, simply not the case. It hasn't been good enough under successive political parties.
He wants to come in, but we've run out of time. Honestly, we need an hour on this. As you can see, there's a lot to read.
Oh, it started a huge...
We've just begun.
We have.
We'll be back.
It started a massive debate about... I think it's the soul of the NHS, the soul of Britain.
Yes. Talking of debates, the TV debate last night, overnight, we will analyse that in more detail too. Back in a moment.
Our app gives you the very best of Sky News wherever you are. Breaking news, videos and analysis.
Evidence of the crisis.
Podcasts, watching us live.
Live here from Washington.
Wherever you get your podcast.
All in one place. And all at just the touch of a screen. The Sky News app. Get the full story first.
I'm David Blevins, and I'm Sky's senior Ireland correspondent. I'm based in Belfast, a city transformed by peace, but still struggling with its past. Politically, the two sides are as far apart as ever, and it's over that question of who has sovereignty in Northern Ireland, the very issue that's been the source of tension here for generations. It takes 60 minutes to cross the Irish Sea. It took the British monarchy a century. I've spent 25 years reporting the journey from conflict to peace.
The political parties of Northern Ireland have reached agreement.
We help you understand the world with us.
Today, we have reached an agreement with the Conservative Party on support for government in Parliament.
We already know what the government gets out of this deal. What exactly does the DUP get out of it? Well, £1.5 billion. Welcome to Winterfell. It's an iconic location in this globally acclaimed drama. Ophelia was the most powerful hurricane this far east in the Atlantic on record. You can't live in a place like this and not appreciate the environment.
I say
Bring it on.
With America divided and tensions running high, get ready for an election like no other.
Join our teams as we follow the campaign trail as America decides.
We will win, win, win.
Get closer to the action this US election with full reaction and analysis.
Sky News, the full story first.
Well, welcome back. You are watching the press preview. Joining me once again, Kevin Maguire and Kate Andrews. Welcome back to both of you. Kate, the debate last night, I don't know if, like me, you stayed up and watched it, or you watched it today. Either way, wow, how fascinating was that? You came away slightly with the fact that babies are aborted at 9 months and migrants are eating pets. But apart from that, what did you learn?
Apart from that, there were a lot of big claims made. I think we learned a few things. Number one, that Kamala Harris was able to rise to the occasion. There was a big question around her ability to communicate the way that she did. It was incredibly clear. It was pretty thoughtful at points. I thought her answers on January 6th, she could have so easily just gone for the former president. Instead, she offered a hand to his supporters and said, look, there's another choice here. He's not handling this well, perhaps come along with me. We saw that Donald Trump has not fundamentally changed. He'll take the bait quite easily and he'll run with it. But look, I think it was a very good night for Kamala Harris. I'm not sure this fundamentally changes anything. It was not like the previous debate in which one candidate had to drop out. You kind of got what you expected, except that Harris really rose to the occasion, and she'll be very pleased with that performance. Her goal was to avoid having brought up some of her extremely left-wing views, at one point the most left-wing senator in 2019, in the Senate. And Trump didn't even get there. She didn't even have to deal with it, because he was getting so flustered and taking the bait and talking about his rallies and defending his ego. So it was a win for the vice president. I think there's a lot more to this election than last night's debate, though.
And extraordinary. It was the first time they'd ever met in the flesh,
Yes.
and then they did it again today to mark the 23rd anniversary of 9/11. You know, you don't see all these people so near each other normally, do you?
No.
You know, 50-odd days out of the election.
Well, they hadn't met, but she walked over to greet him and shake his hand. He didn't go the other way, and she was the prosecutor who knew how to trigger the defendant, the accused, and just set him off. Just talk about him being boring and his rallies not being so big, and off he goes. Totally off script. That weird tag. Well, he might as well have put it on his forehead. And I think that's where she was seen to win. I agree, it's a long way to go. Is it 7 states are going to decide this? Yeah. But she is well in the race.
Yeah, I mean, the Daily Star's, you know, having a laugh about it. But it is very, very serious, and there are many who are undecided. And it is said that those least informed are last to decide. Now, who knows? They might not watch last night. Massive, massive viewing figures they had. You know, we've only got 30 seconds left. Anyway, so will the undecideds be moved by this, I suppose, is my question.
I think the big question last night is whether or not the undecideds could make up their minds about someone that they just simply couldn't tolerate. Because the truth is, if you haven't made up your mind yet, you don't have great love for either candidate. The question is, did you see something and go, I can't vote for that? I personally think if Donald Trump had managed to land a few more blows about her support for the Green New Deal, support about overhauling healthcare, support for defund the police, he might have had a better night.
Taylor Swift was the win for Harris.
That was coming anyway.
Kate Maguire and Kate Williams, thank you both very much. It's been very good to hear from both of you. Lots more still to